So I apologize for walking in just now. I had a family emergency situation this morning that just kind of sent me in a different direction. And then I went in a different direction, and I drove, for whatever reason, I drove up Route 309, which takes me to Quakertown instead of taking 611, just not thinking whatsoever.
Do we need
All right, this is
to
fun.
confirm that?
You can try. I'm pretty sure I can get through it. So anyway, Eric Abel, retired from Lancaster City PD. I was a juvenile detective before I became the supervisor in sex crimes. So I've worked both angles. Please feel free, the group is not that big. Please feel free to ask questions while we're talking, that's fine. I think the important thing to get across today is for us to let you know what we do, what we're looking for, what we're trying to do for you, so that you can interact better with the polygraph procedure, so that you're not afraid of it. I think that's one of the big things that comes across from probation is sometimes, especially in the juvenile realm, POs are afraid of it. We don't want to have to make reports on our clients, things like that. So we're here to address some of those issues and some steps that we've taken to try and alleviate those situations from happening when we don't need to. Sometimes it's very appropriate and it just needs done, and sometimes we can handle it. So those are some of the things that we want to talk about. But what I'm going to do first is I'm going to kind of take you back to the beginning where this all began, which was Colorado, where the governor worked with probation there and wanted to do a little bit more with their sex offender clientele to better protect the public and also protect the clients. So they developed this system, this triad, they called it, of probation, therapy, and polygraph. Those were the 3 points of the triangle to keep the offender in line, to keep this community safe around the offender. I ended up having the pleasure, sir.
How long ago was that?
We're talking probably 25 years ago, that they began this protocol, and then it spread, and ATSA, groups like ATSA picked it up, groups like the APA, which is not the Psychological Association, but the American Polygraph Association picked up on it and developed a course curriculum for it for the polygraph examiners. So I happened to work with a probation officer actually from Sunbury, Northumberland County, who came to Northumberland County from Colorado. And she was a supervisor, a state probation officer supervisor for sex offenders in Colorado, and she was on the governor's board that first developed this. Her husband needed to move back home, which was Sunbury. She came back to Sunbury. When I met her, she was 60, and she was still carrying a gun and locking people up in Sunbury. And truly in Sunbury, the probation office is 1 block away from a rock wall prison, if you've ever seen it, and they don't drive people, they walk people down the street to the prison. So a little bit old time, but she was a wealth of knowledge, and she taught me a lot about how this all developed and why this came to be. So the whole idea was to keep the offender from violating, to keep the community safe and the people safe around the offender when they're out on the street, and also have the offender more invested in their therapy. That's the whole idea behind what we do. So there's 3 different types of tests, and I'll start there, that we use with SO polygraph. The first test is a denial. Denial is for the offender that comes out of, in the adult world, prison, or comes out of court and is still denying their offense. So they have an adjudication, but they're still in denial about their offense. So the idea is that we want to break that denial so that the treatment can actually begin. We want to break the denial so that the offender can see his responsibility and take the appropriate actions for it, or did he do it? Because maybe he hasn't had the opportunity to do this before. Now, we don't run into a lot of situations where we have offenders that have been adjudicated and come to us and they end up passing the test. But it does happen. We all know that we don't have a perfect court system, and sometimes things do move through the system that maybe shouldn't in the same manner, or maybe get adjudicated of crimes that didn't go that far.
Eric,
Yes.
are there, when you have circumstances like that, are there also that class of individual that are just cold, the cold-blooded,
Right. They're just going to be able to.
sociopath
Right.
that, can beat a polygraph even though they did do it?
So the sociopath is maybe a person that could get through a polygraph. But during our interview, because we have a whole interview phase before we do the polygraph, usually an hour or so that we actually sit and talk with a client before we do any kind of testing. We, because of our experience and what we've done in the past, we're usually able to pick up on those cues, or therapy has been able to tell us, look, this person is extremely antisocial. There's a deficit, a social deficit here, so that we're on guard. The whole thing changes, because then it becomes a game between you and me. You want to beat me, and I realize that. So now it's a game, and they're not going to get through the game. So it's not about their guilt feelings about committing the crime. It becomes the feeling of them wanting to beat me at the polygraph, so they can't get through. That's not a situation that we see, especially in these kinds of denial tests where it's, did you do it? That's what we're asking, did you do it?
When you say they can't get through, you mean you fail?
Right, they're still going to show reactions.
Okay.
They're still going to have a problem on the test if they did it.
So it's a myth that sociopaths can beat polygraphs?
It's not a myth. They can beat examiners that aren't experienced doing this.
Okay.
But they can't actually beat the polygraph. The polygraph itself is an instrument. And just like going to a doctor to get an EKG done, it's going to record what it sees. And the same thing here with us, it's going to record what it sees. And Bob will show you some charts soon so that you can see actually what we see. But just like going to your family doctor, I'm not saying anything about your family doctor, but if you get an EKG done with your family doctor, and he looks at it and he says, oh yeah, everything looks fine. And then you show that same EKG that same instrument took to a cardiologist, the cardiologist might say, I see a little bit of this and I see a little bit of that. So I'm not trying to toot our horn, but I've been an examiner for 24 years. I've talked with in the neighborhood of 4,500 SO offenders. So we're talking about experience leading up to that point of the experience going into the test and the exams that we're doing, rather than having someone maybe that wasn't in law enforcement, that wasn't an investigator, that didn't work sex crimes doing the exam.
So along those lines then, because you talk in terms of it being a game,
With that person, not with most, but
Okay.
with that particular person, yes.
what, if any, degree of manipulation can there be from the standpoint that, as an examiner, that you're able to elicit information from an individual that could cause them to fail a polygraph when they might not otherwise?
Yeah, I don't know that that's really a concern, not the way that we handle things, because we don't interrogate people. That's not really our ball game. That's not how we handle ourselves.
So it's all about, the interview is all about setting things up for the polygraph.
Yeah,
Okay, gotcha.
so the interview is about setting things up for the polygraph and allowing the person to talk, allowing the person to get things out on the table that maybe they haven't talked about before, so that they can get through this test. And what we tell them is, our job is to help you get through the test. Our job is to let you get things out today that maybe you haven't been able to talk about before, and it's okay. You can talk to us about those things. And when they do that, then they're able to pass the test. So, and it's just like I tell offenders all the time. If you've made mistakes, if you tell me about the mistakes up front, we will be able to rule those things out of the questions on the test, and you'll still be able to pass the test. Yes, you still have things to deal with in group and with your therapist, because these things are going to go back to your group and your therapist and your PO. These are things that you need to work on, but we will get you through the test if you tell me about them before the test. If you wait till afterwards, if you try and see whether you can get through, it's not going to work. You're going to keep a secret, and that's what polygraph is really all about, is about that secret. So the denial test is about their actual offense. We're not going into other areas. We're not doing questions about what's been going on since you've been in treatment or since court. It's about the actual offense. We want to find out what did happen and what didn't happen. And as we all know, and especially in these kinds of crimes, there's a lot of times when the report, the initial report, and our client's claim that maybe the truth gets worked out in court to be somewhere a little bit more in the middle. That maybe there's been some exaggeration, something along those lines, and the charges get whittled down until it's something more appropriate. And I think that we see that. Do you agree that we see that a lot of times, that what ends up coming out, the adjudication ends up not necessarily being what was initially charged?
It can go either way. Sometimes somebody will have a slick attorney, and we find out that the person did a little bit more than they were convicted of, but it
Right.
can also go the other way.
But that's not what the denial test is for. We just want to find out what part of this they did actually commit, so that, again, that they can move forward. And I'm going to say that most times we're able to get a little bit closer to that by the time we're done. You either have a failed test that you can work with in therapy and again, try and move ahead, or you have an admission prior to the test and a pass test. So again, you have information that you can use to move ahead with this case. So that's the denial. We don't do any other kinds of questions. We don't talk about anything else. We stay strictly with the offense. This is what Bob and I did as police officers. These are the kinds of tests that police do all the time. It's basically the same thing as a police test.
With one minor difference. In this setting, we may end up polygraphing this person 2, 3, 4, 5 times over the next couple of years, depending upon how long they're on supervision. So when they fail a denial test, it's not as controversial as if we're doing a test for law enforcement, where we're going to attempt to interrogate and get them to confess and go at them for hours until they confess to help law enforcement get it through court. Post-adjudication now, we got to keep that rapport, and that's where we fall back more on you guys to we call it priming. Hopefully we're priming the pump to get them to spill their guts to you. But we can't wreck that rapport and mess up subsequent tests in the future.
So the next type of test that we're going to move towards is called a sexual history. There's been a lot of controversy about a sexual history recently because of all the new reporting laws and things that we have to report that we didn't have to report before. Or we have to make a call sooner than we made it before, I think is a better way to say it. So sexual history is about, for us, getting someone to lay everything out on the table, all their sexual behaviors, so that we know what's going on, and they, again, are able to move ahead in group. The person that comes out of court and admits their offense, they would go right towards the sexual history as the protocol calls for it in the polygraph world, okay? Does that all the time happen? No, because sometimes attorneys, will not want that kind of a test to be done. Sometimes there's other things that get in the way. And then we move on to the maintenance, but we'll talk about that in a minute. So the sexual history is to get all those other things out of the way. that we need to know about, because just because our client has committed an indecent exposure, let's use that as an example, doesn't mean that he also hasn't peeked or that he hasn't stalked. So we need to find out about those other things so that you know what red flag behaviors are present in order to move ahead. Therapy needs to know about other behaviors so that they know what to work on in group before they end up back out as an outpatient. So what we do and what I've modified, we used to talk about victims. We used to talk about numbers of victims. We didn't talk about names or locations, but we talked about, for instance, an age. I've eliminated all that from any juveniles that we see. We no longer do talk about actual victims. We talk about behaviors only, so that we're not putting ourselves in positions to make reports about every client we have. Yes, ma'am.
I am a probation officer, and it's come up that we have victims that are maybe living in the household or that they have contact with, so that's a safety issue. So we
Right.
can't return, so how do you deal with that? Because we have to report things like that because it's a safety issue. We can't return a child into a home where there was a victim.
Right. It's not that we can't do it. We can if you guys need us to do it. It's just as a rule, this is what we're going into now. There's case law in Pennsylvania that we can't use polygraph to ask Fifth Amendment questions. So if we're asking a question that's going to put the person in jeopardy of being charged with another offense, we can't ask that. If charging is off the table, then we're fine. So I understand what you're saying, but I think that if there's a child victim in the beginning, then we should assume that this is not a safe place for this person to be. It doesn't matter whether it was in the household or not. And I think that's a decision you need to make with therapy about what's an appropriate place for the person to be discharged to. So I think if there's a child victim, then we should assume that these other people are at risk until we know that they're not.
If the clinical team's trying to determine if there's deviant arousal based on the sexual history polygraph, like if there's other victims, can you do age range instead of specific age?
We have done that. We have done age ranges like, up to age 10 to 15, 15 on. So we can do that because we're not actually pointing out someone, and we're not asking if they were a family member. We don't want to know who they were. We don't want to know where it happened.
And that makes it less likely that you could find an identifying factor.
Right.
It doesn't mean, we've had to do it in the past couple months here, it doesn't mean that we don't make and follow the law and make notifications.
Right.
But the question and information is extracted from the person in a way that it's a dead end.
Right.
I mean, it still helps therapy. They still know that this person, we found things that they're doing that no one knew they were doing. But there's nowhere for law enforcement to figure out who it is.
Right.
So I could give you an example of something that came out of a sexual history that was surprising and everyone needed to know. I worked on a case out in the western part of the state with a young guy who had actually approached a minor female, probably around age 5 or 6, and pulled her pants down. So he was 18, 19, and I realized he wasn't a juvenile, but he had been doing this for a while. So what we ended up finding out through the sexual history polygraph is that his thing was actually he wanted to see the little girl's panties. And that was his thing. He was buying panties, he was wearing panties when I polygraphed him. That was what he wanted. He says that he did not want to commit an actual hands-on offense. Now, we all know where to put that. We know, to put a big question mark behind that. We don't know that that's not going to happen in the future. But it brought out this whole other world about like him going to Kmart and stealing panties and things like that. Things that a PO would need to know. Yeah, you can't go to Kmart. You can't go to Walmart. You can't go do those kinds of things anymore. rules that you needed to put into place, and it all came out through this sexual history polygraph. A simple way to demonstrate the kinds of things that might come out. The indecent exposure back to him, maybe we find out that he does have some type of a minor victim in the past, even though he's only exposed to adults at this point in time. There may be other things that we find out where it crosses over and there has been a minor involved in the past. Things, again, that you need to know because of where to put them, where to release them to, questions like that. So what we've tailored a sexual history polygraph for juveniles is we only talk about behaviors, we don't talk about actual victims. If there's a need to talk about actual victims, that will come to us through therapy, and we'll handle that appropriately at that point in time. Then the last test is a majority of what you see in the outpatient world is the maintenance test, where we're talking about behaviors since their release, since they're in treatment, since court, since their last polygraph is going to be the timelines that we're going to pick to use to talk about their behaviors after they're out in the world again. So we're going to ask about who they've had sexual contact with. Again, we're going to use, male or female and an age. We're not going to ask for specific names or specific locations. We're going to ask about masturbation history, their porn usage. I think that we're pretty up to date as far as internet. We're asking, in our interview, we're asking about secret browsers that don't track history. We're asking about smartphone usage. I can't tell you how many guys, adults that I find out have more than one cell phone. Many of these guys have more than one cell phone. They have one hidden away, or they have one that isn't turned on, but they can still use Wi-Fi. Things like that you need to know, because you need to know what to look for when you're going and doing a house visit. So we're trying to give you information about red flags, things that you need to be aware of so that you know how to handle this client on the street. I feel like our job is always to bring you back something that you didn't know and to give you clues. We're not going to solve issues for you. We're going to give you clues so that you know where to go. You know what to talk about. Therapy knows what to talk about in group or in individual. Those are the kinds of things that we want to bring back to you. We're not going to answer every situation because we can't ask enough questions. The actual test that we use, we're asking 3 questions. Bob will talk a little bit more about the test, but we're asking actual 3 questions that are of a relevant nature. The relevant nature is, since your last exam, have you had sexual contact with anyone other than your girlfriend? Since your last exam, have you viewed pornography more than the one time you told me about? Those types of things that you feed to us that are concerns. And that's what we want to know before exams. We don't need you to write questions. Tell us what you're worried about, and we'll sort it out from there. Maybe we'll answer one of the topics of concerns during the interview, and so we don't need to ask it on the exam. We'll pick something else out from the interview. We don't know what exactly we're going to ask or how we're going to ask it until we're done with that interview, because there's always things that come out during the interview where we have to actually change the way that we've asked the question or even what we're asking. So if you call me ahead of time and say, I want to know what you're going to ask Bobby, I can't tell you. I don't know until I'm done talking to him, because I don't know what he's going to tell me. Maybe he's going to tell me that he viewed porn once, maybe he's viewed porn twice, maybe he's going to tell me he's viewed child porn. I don't know what that answer is going to be until I'm actually done with that portion of the interview, and then I sit and I write the questions right there, right then, in order to satisfy what you guys need to know. So those are the 3 types of tests. We're using multi-issue testing for sexual histories and maintenance because we can ask 3 different topics. With the denial test, we're using single issue testing. So we're asking about the worst part of the offense. And if necessary, we'll do more than one test. If there's too many things, he grabbed her butt, he grabbed her breast, he touched her vagina, and he kissed her, well, we're not going to be able to do 4 tests. So then we might need to use a multi-issue test and then a single issue test to back it up if there's a failure. That's a little bit more, but when you see reports, I know that these questions come through your mind. And, why is this report, there's 3 different topics asked, and why in this report is there only 1? Well, it's because of the rules we have to follow for the APA in doing sex offender work. We have to use certain types of tests that are approved, and we have to ask it in a certain way. When we ask those relevant questions, we're also asking questions usually dealing with character. We're usually using mostly things that are probably discussed in group often. Untrustworthiness, their ability to manipulate currently. We're going to throw in questions like that to gather response from the person who is not doing anything wrong so that the person can pass the test. Those are the questions that we compare the relevant topics to. Are these character questions? Do you feel like you're being as manipulative now as you have been in the past? Well, most of us deal with SOs who should be at a place where they're a little better now, and so they're going to be concerned about that question because they don't want group to jump on it. This kind of leads me into the topic of there has to be consequence for polygraph to work. We have to have a consequence at the end of the day for them to pass this test. What we're dealing with is, most of the time, getting in trouble with group. Having not have been honest with group. And it's probably, I'm going to guess, for this age group, it's more important that their peers are able to believe them sometimes than the therapist. Am I right? Yeah. So they don't want to come back with a bad polygraph test or things that they've left out from group because other people don't necessarily now trust them or believe them. So obviously for the person that is hiding behaviors or hiding what they've done initially, the consequence is everybody's going to know what's happened. Maybe even mom and dad, right? Get to find out eventually that this actually happened. And prior to this, they believed me. So there's a consequence at the end of the day. When we were police officers, obviously the consequence at the end of the day is you're getting a pair of handcuffs put on you. That's not necessarily the case here because we're dealing with this from a therapeutic standpoint. We're dealing with this from a therapy issue. Although obviously it's crossing over to you guys and you guys are concerned about that, we have to stay in that therapy mode in order to keep the courts, the Pennsylvania courts, in line with what we're doing. They have always backed us up to this point in saying that polygraph can be used for therapy, for SO therapy. That said, we also have case law that says that we can testify to polygraph in administrative court. So you're going to have to help me with this one. After juvenile court and after an adjudication, if you come back with a violation, a technical, is that still in juvenile court?
Yes.
Okay, so it doesn't jump into a different court. All right. So that has to be tested yet. Where can polygraph come into juvenile court in a technical violation? I know it can in adult court because it's administrative court because I was the one that testified and made the case law for Superior Court in Pennsylvania. So what they said was, and I think it would carry over to juvenile court, is a county court judge is a big boy and he can make his own decision about what he hears. He can decide whether he wants to take it into consideration or not. So that being said, I would think that would jump over to juvenile court since it's a judge. If you are in front of a master, then I don't know. I'm not so sure that would carry over in that case. But if it's a judge, I think we could probably assume that this is going to carry over.
Yeah, or can, whatever. The judge could take that into consideration and weigh as heavily as they want to.
They're a big boy, they can
Yeah.
make their own decision. Right,
But we
okay.
can't violate if their deception indicated. We would ask whoever is like the therapeutic team, if they fail, then it has to be your policy that they're not complying with treatment, and then that could be the violation.
Right,
And that happens here. When kids fail polygraphs, there's all kinds of behavioral level changes and movement and back and forth between sides. So it's not just a clinical matter. It affects the kid's entire experience here.
right,
So
okay.
that's another consequence for him.
Right, which is, again, at the end of the day, that's the consequence, to get everything out so that you pass the polygraph. That's the consequence, is because they know there's going to be rule changes coming down the road if they don't handle it
And they
properly.
know that Dana or their PO can pull them for noncompliance. They
Right.
just can't call it failing a poly.
Right,
Yes.
right. So it's all in how we term it, it's all in how we word it. We're not in Philadelphia where, I was in Philadelphia yesterday and I had a client, an adult client fail, and the therapist called the PO, and the PO said, "Put him in your lobby, I'll be down," and brought a team in and arrested him in their lobby and took him out because of the failed polygraph. So we're not there, I understand that. Things don't work the same way. They don't work the same way for them because they have so many clients. They can't afford to have this guy out possibly committing new offenses. So basically what they do is they put them in jail to sort things out, to figure out what's going on, to have a chance to talk to them before they take off, because that's what happens most of the time. They're going to figure it out and then maybe let him back out or take him in for a PV. Depending on where you're at, you're going to have your own home rules that come into play. Not everybody's going to have a Montgomery County judge that wants to hear all this, and some are. So home rules going to take a lot of effect in how this gets handled. When you're dealing with examiners, you should be looking for a couple things. You should be looking for experience in number of years being able to do this. I believe, my personal belief, and the people that work with me all have experience as law enforcement investigators doing sex offender work. They all have experience as law enforcement investigators doing polygraph work. That's my bottom line. I had a silly story, but it makes my case. I had a woman call me, this is probably 7 or 8 years ago, and she said, "I just graduated from polygraph school and I took the sex offender training and I'm in a career change and I'd like to know if you have any work for me." And I said, "Why don't we meet and we can talk?" So we met and we had lunch. And I said, "So what did you do before you decided to be a polygraph examiner?" She says, "Oh, I was a drug rep." I said, "Okay." I said, "Have you ever talked with a sex offender before?" She said, "Yes, in school." Oh my God, the stories that I heard. I said, "Yeah, I don't have any work for you." So a person with that kind of response to this, it's just not going to work, because every day they're going to be shocked. They're probably not going to last. It's just not going to work out with us. It's not to say that she can't do the work. She's certified to do the work, but I think that we bring something a little bit different to this, where we have the experience to back it up. Anybody have other questions? Do we need to take a break, Dina?
No, I'm going to turn the heat up.
Okay. They need to have the APA certified class that says that they can do sex offender training, obviously. They need to have insurance minimums according to the APA in place, and I'm sure if you're giving contractors work through your counties, they have rules about making sure that those things are in place. In general, because we're going to get into a specific case and actually see some charts here in a minute with Bob. In general, do you have questions right now that I can answer for you? We'll have another point in time that we can take more questions also. Yes?
Depending on the polygrapher, sometimes they'll say they passed or they failed. Other times it will say significant reaction, not a significant reaction.
Right.
So for me, as a probation officer,
What does that mean?
I want something straightforward. Did they pass, did they fail?
Right.
Not it was significant or it's not significant, what?
Right. So while we can tell you on the phone, yes, they passed, or yes, they failed, we can't put that in a report. That's against our rules. We have to say no significant reactions noted or significant reactions noted. No significant reactions to you, pass. Significant reactions, fail. And in our reports, at least, we're going to back that up with at least whatever the person told us, or we're going to say in the report, we didn't get anything out of them afterwards, or what we did get out of them. Most of the time there will be something. We'll have some discussion that we'll be able to put in a report. And sometimes we just have people shut down at that point. And they'll say, I have nothing else to say. They know now that someone else knows their secret, and they're afraid to open their mouth because they're afraid they're going to give it up.
And I also know that laws have changed, so there's not as much information. But polygraphs in the past had sexual history included. Polygraphs now are very brief, and you're only getting a snippet of what actually was discussed. So,
From us,
well, I'm talking
in general,
in general.
now you're dealing with a specific examiner and how they handle things. So our reports are going to give you everything that we talked about. Even if the answer was no, 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 you still know that we asked, did you view child porn since your last exam, or are you using a secret browser, or do you have PlayStation 3 at your house because it's connected to the internet? You're still going to know that we asked that, it's just that the answer is no. I know that there's many other examiners out there where their report is a page to a page and a half, where ours is 5 or 6 pages. Because we're going to tell you that what we did talk about and what we didn't talk about. It's important for you, just like it was important in our police work, and what's the reason that we have it in the report. It's just as important when a person answers no as when they answer yes. Because maybe they've told you yes in the past. Maybe they've told therapy yes in the past, and now they're saying no. Well, that's a difference. We need to figure out what's going on. Why is that the way it is now? So that's why we have all the no's. That's why we're telling you that. If you have that kind of a situation, it's because your examiner has elected not to put that information in.
Well, when we deal with providers, we can't pick the polygrapher.
Right.
Sometimes the providers have their polygrapher, so you have to go with that polygrapher.
Right. Right. So you can talk to the provider, though.
Yeah, I do that, and if I need more information, then I want the whole report. I don't just want a snippet of.
Right. Right. Other people, other questions at this point that I can help you with?
What does inconclusive mean?
Inconclusive means, could mean a couple different things. It could mean that we're not asking about the right topic. We're still not on target yet. And I'll explain that a little more. It could mean that the examiner has worded the question poorly. When we ask in a sexual history if someone has had contact with other victims, and this person has been a victim themselves and never disclosed that, we're going to get a hit on that question. And it may not be a fail, it may be an inconclusive, because they have a secret about victimization. So I'm not saying that that's it all the time. I'm giving you an example of what an inconclusive could mean. There's a piece of information that we haven't learned yet that has something to do with this person. There's a secret that they're still keeping. It's not exactly what the question's asking, but it has to do with it. And maybe it's their own victimization. If we're off target because something worse, this person has done something worse than what they're here with us for, and that is unknown, never charged, never investigated, and they don't talk about it, that could be an inconclusive. Because they're really not concerned about what they're here for. They're much more concerned about what we don't know. So, again, back to Philadelphia, you know, we're seeing someone that's convicted of a sex crime and they've committed a murder and nobody knows about it. Yeah, you know, we could have an inconclusive test because of that. We're not on target yet. There's still something missing.
And that's the reason why we can't say pass or fail, because as accurate and as precise as we want to be, we can't see inside the person's brain and know for sure what they're reacting to. So that's why it's either significant reactions, or you may also see in a report, depending upon when an examiner went through school, the report may say deception indicated.
Yeah.
Deception indicated, significant reactions is the same thing, meaning they had reactions to something on the test. So that's why the report can only say significant reactions, no deception indicated. It may say no deception indicated, or significant reactions, or no significant reactions. But, and that's also why we can't say for sure what Eric just explained about what would be inconclusive. When a person makes a post-test admission, I'm getting a little ahead of myself because of the case study, that doesn't mean for sure that that was the reaction. It just means that's the avenue to start, for you guys to start exploring. Because it doesn't mean for sure, we don't have the time to do 2, 3, 4 confirmatory tests. We're not going to do that. We can't, we don't have the time or resources to say, is this at this point for sure what this person's reacting to?
Are there degrees or a range of reaction?
Yeah, but
I mean, you know, so like you could say significant reaction. I'm thinking like, you know, it's off the charts, and you know, there might be. So I'm just curious.
Right.
And how do you interpret that?
so we have scoring that we use when we look at the chart, and Bob will explain this to you with the charts he's going to show you. We have scoring that we use, and beyond beyond a -4 is a fail, beyond a +4 is a pass, and anything between -4 and +4 is inconclusive. So obviously we want to stay out of it. We want to be much more affirmative. We want to give you good information, and so you don't see a lot of inconclusive tests from us. We're going to have good, solid results. But the psychopath, he might just be a -4, where someone else might be a -10. But because of just to bring it around to what you were talking about before, he's still going to fail. And so we're going to see degrees, but we're not going to report degrees to you. Maybe we'll tell Dina or somebody, hey, this is just crazy. He's probably ready to talk. This is probably a good time to get a hold of him and talk to him because he reacts so highly to this. That's one thing that would tell me is, an off-the-charts kind of thing. I just wanted to talk a little bit more about using polygraph and probation. Sometimes we get requests through the therapist who want to please the PO because they want to get referrals, and so they're trying to appease this, a particular PO who wants us to ask questions about, since your last exam, have you, used any illegal drugs? Well, to me, there's so many other good tests for you to use out there that are affirmative, yes, no, and you can take it right into court other than polygraph. To me, that's a wasted question. We want to find out if they're grooming new victims, if they're spending time where they shouldn't be, things like that, rather than asking a question about if they're out after curfew or whether they've smoked marijuana since their last test. So we try and stay away from that. If there's a reason why we need to go in that direction, tell us why. Give us a focus so that we know what that reason is. Maybe all of a sudden this is a new behavior that they haven't done before, so you haven't been doing those tests. That would be a reason why we would maybe want to put that on a maintenance test, because you think this person is headed back down the wrong set of tracks. So that would be a good reason why. But if it's just general monitoring kind of things, you know, you have drug tests available to you, I'm sure, and you can walk those right into court and say, he needs to go back. Whereas with us, it's not as easy as we talked about. So use those tests available to you first if you can, and then if there's specific reasons why, come back to us with those kinds of questions, if that makes sense to you. Any other questions for me? And I'm going to turn it over to Bob. And then we'll both be here to answer questions after he's done. Do we want to take a break first?
Whatever
You
the
need-
group wants to do.
Do you want to take a break?
5 minutes.
You need 5 minutes?
I thought I'd make this a little fun. Hopefully it's a little fun, so you can kind of see what we see. Obviously, you don't expect anybody to put polygraph charts in front of you and be able to know, but we pulled up some things that were obvious, so you can kind of see what we see a little bit. You wanted me to have a little fun in the beginning here. So to help you understand what makes polygraph work, I thought I would kind of do a little overview on how we would explain it to somebody we're testing, okay? So obviously some of this, especially if you have a strong anatomy and physiology background, I'm skirting some of the things, but it'll still help you understand. So we'll explain to a person that the polygraph, how it works, is a combination of understanding the difference between your voluntary and your involuntary nervous system. Okay, we'll talk to them about when they drive a car, whatever their activities are, they're using their voluntary nervous system. The brain uses the same nerve path to control the involuntary nervous system, things to keep us alive. We don't have to think about our heart beating. The involuntary nervous system does that. So, you know, we'll talk about how often in one of the things I do when trying to develop rapport with them is I'll find out like things they like to do. So a guy will tell me that, and I don't mean to offend anybody, but he'll say he likes NASCAR. I could care less about that, but I'll act like I like it. And so, you know, we'll role play and say, well, you know, let's say you invite me over to your house to watch the next NASCAR race, and we're sitting there, and our involuntary nervous system tells us that we're hungry. So we have a feeling of hunger. We use our voluntary nervous system to get up and go into the kitchen and prepare food, sit down, grab the food, take a bite of it. All of it's still voluntary. It's all intentional. You're doing that. But as soon as you swallow the food, your involuntary nervous system takes over. We don't have to think about the stomach digesting the food. We don't have to think about eventually the intestines extracting nutrients, what save you. And so it shows how the voluntary and involuntary can go back and forth. And so once they confirm that they understand that, then we'll say, okay, then you also need to understand part of polygraph, what works is you understanding what I mean by a sight picture. So especially with adults, I'll often say to them, so let's say you're here today because the police think you're the person that robbed the bank. Okay, we know you didn't rob a bank, so we can joke about that. The person went into the bank and actually held a pistol in their left hand and pushed it to the forehead of the bank teller and told them that they were going to blow their head off if they didn't give the money. So then you say to them, if you did that on the test, I'm going to ask you, did you rob the bank? Or are you the person that robbed the bank? So they're saying, okay, yeah, I understand. Okay, so now I want you to think about, and you can all do this, don't give any details here, we're not to embarrass anybody, but think about the first time you had consensual sex, when you wanted to, and everything was good about it. You have to say it that way because you don't want someone to lock in if they were victimized, okay? So they can think about that. Okay, oh, you just pictured either where you were, what you were wearing that day. Women can remember scent. You know, sometimes with women I'll say that to them because they relate to that. Man, if that guy walks past and was wearing the same cologne that you can remember that, can't you? Oh, yeah. Okay. So you get them to understand what you mean by a sight picture, okay? So if you're the person that robbed the bank, when I ask you that, your brain is going to lock in on you holding that pistol against that person, just like how you recalled your sexual encounter, okay? So everybody with me? You understand what I mean by sight picture, right? So you start getting them worrying about, so then you explain to them that the polygraph works on, if there's something up here we don't talk about, or if there's something up here that's in contradiction to what you say,
that problem is reaction is what's called your fight or flight syndrome. And then we go back and talk about the voluntary versus involuntary. So we're talking about things like when they've experienced fear. Have you ever been pulled over by the police? Oh yeah, remember what that felt like when the light bar went on? And I tell them, if I had you hooked up to a polygraph instrument, I would be able to tell the moment that the light bar went on and you knew you were the one getting stopped because you have that feeling. You know, and I asked them to imagine if they grabbed money out of an ATM and they turned around and there was 10 guys standing there with baseball bats wanting to rob them. How would that feel? And they talked about, oh, I would feel this. Well, that's what happens when you lie, okay? The polygraph monitors your reaction to fear or feeling in danger. Is there any danger to you as you sit here today? Oh, no, no, no. Yeah, I'm not going to do anything to you. But there's still one danger if you lie or if you keep secrets. And so that's what you do to get the psychological set in place. Does that make sense?
Yes.
So when Eric was talking about we're asked character questions, we disguise them and tell them it's character questions, but in the polygraph world, and don't share that outside this room, that's really a control question or a comparison question. Polygraph works on, are they more worried about what group is going to think about them, or are they more worried about their offense? If they didn't do something that you're asking a relevant question, they're going to be more worried about what group's going to say to them. In the police setting, if I can convince them that the police are going to think they did this crime because of when they lied to their mom and dad about doing drugs or something like that, they're going to lock in on that. Oh no, you get them to think, you know, I can't tell him that I stole from my mom and dad. He's going to think I'm the one that robbed the bank. So that's, I mean, it's a lot more convoluted than that, but kind of understand where we're coming from. Are you with me? So you have to get them set in a place on the truthful person or people that's not keeping secrets, or the innocent person is going to lock in and be more worried about the character questions. The person that is keeping secrets or is afraid of getting caught on a crime, no matter what you say, that's what they're going to be locked in on. Make sense?
Now, how about for an individual, let's say someone that's got an IQ of 65 to 70, you know, in that range?
Well, I won't go by a number. I'm going to go by, and we're going to go by the pre-test interview and find out if they know the difference between right and wrong. And it doesn't mean that the questions might not have to be, you know, scaled down and be more simplistic, okay? Where someone you might, you know, lock in about lying to your parents about how many times you did drugs. Someone like that, you might just say, did you ever lie to your parents? You know, because they might, oh, if he knows I lied to my parents, he's going to know that I did this. So yeah, sometimes you have to go with the person, but that's part of, there's a lot of things that occur in the pre-test interview, but that's one of the things making us feel comfortable that they understand what we're asking. Okay, good question. Anything else? So, giving you a little background, I'll show you some charts and explain a little bit here. So here's a test that we did in this area. And so on the polygraph chart, the ones that are green are the character questions, the ones in red are the relevant issue questions. The gray line is the amount of time it takes to ask the question. The black line is when they answered. You can't really tell from in there, but it would be a plus if they said yes, a minus if they said no. So knowing that we talked about the fight or flight syndrome, what happens when someone experiences fight or flight, their respirations decrease, their blood pressure increases, sometimes their pulse increases, and they have more electrodermal activity, like nervous sweat, okay? So you can see the relevant issue question here, I don't know if you can read that back there, it says, other than what we talked about, as an adult, have you ever had any type of physical, sexual contact with a minor? Okay, so we were trying to find out if there was additional victims. Okay, this was on a sexual history. So you can see on the character question, a little bit of reaction in the blood pressure, a little bit of reaction in the electrodermal activity. Respirations pretty much stayed the same, a little bit on the question onset, but that's suppressed as they're getting ready to answer. Now compare that to the relevant issue. Look how much the blood pressure increased, certainly electrodermal activity, and look at how the respiration's suppressed.
So Bob, which one's baseline? Is the green baseline or is there?
That's the comparison,
Okay.
all right? That's the only thing you're comparing. I mean, you can look at other questions. I mean, I don't have to give you a whole, I hope I don't have to sit here and explain. There isn't really baseline. I mean, we're looking at things to make sure they react. There is what's called norm questions, like, are you in Pennsylvania? You know, is the month January? Those are things to kind of just make sure that we're doing other things on those questions to make sure they're not doing countermeasures and stuff like that. But basically, you just need to understand that we're comparing between here. And I wanted you to be able to, can everyone see the difference between how they're still reacting? And that's good to know too, to go back with you said. You want to make sure they can react, because that shows that they do have some sort of remorse, that we're not worried about that whatever their psychological issue is, that they're not testable. If someone doesn't react at all on anything, then that would not be a valid test. Okay? So everyone sees that so far, how the respiration stayed the same on either side, and how that's the larger reaction, right? Okay. Same test, this is the next chart. Same question, number 6, whether they had. See how much larger the blood pressure increase is. See how is larger, okay? Respirations, this one's a little bit. So, we talked about scoring. So I'll go back to the last one. So a simple scoring, to not be too confusing, would be to do a plus or minus on a spot. So, meaning, that's a +1 because that's greater. That's +1 because it's greater than that one, and that's a +1. So this spot right now has a +3. Okay?
Other way,
Where?
minus.
I mean minus. Yeah, I'm sorry. Minus for, because he reacted to a relevant question, plus if they react to a character or control question. All right, so that's a -3 spot. With me? Going to the next chart. You could debate on that. If it's close, I'll zero it out. Always give the person the benefit of the doubt, okay? I want a truthful person to pass, okay? And that would be a minus, and this one would be a plus. So that spot would just be a -1, right? Okay, so you have 2 minuses and a plus or a 0. So you could either have -1 or -2 there, depending upon whether you think that's larger or whether that's zeroed out. So right now, just on 2 charts, you have a -5 or -4. You already have enough. If it stays that way, you have a DI or significant reaction, and you know that they're lying to this question. And this test, it was confirmed because post-test, the guy said, well, I never told you about a 13-year-old girl that I groped her foot while she was sleeping, and it was sexual for me. In fact, I masturbated to that later. Now, that doesn't mean that that's all he was thinking about, but now we know, for you guys, to explore. And doesn't mean that later in a subsequent test, we might, now this guy, oh, who else has he been touching when they're asleep? And that kind of thing. Make sense?
Yes.
Questions?
Can you say the negative and positive again when they react to which one?
Okay. I'll go back to the first one. So if the reaction is to a relevant question, it's a minus. Because remember, Eric said -4, they have deception. +4 or greater, no deception. In between would be inconclusive. Okay? That's a larger reaction, so that's -1 for respirations. That's a larger reaction, -1 for electrodermal activity, -1 for the largest cardiac reaction. So that spot on this chart is -3. With me?
Yeah.
Okay.
It's positive, it's to a character question.
Right. So let's say on this one that we could debate. Let's give the benefit of the doubt that this is a larger reaction, meaning there's more suppression. So respirations could be +1 when you're comparing this. That's better, that's a plus. This is larger, that's a minus. That's larger, that's a minus. That's why I said when you take a +1, a -1, a -1, now you have a -1 spot.
But why is 1 + 1 and 1 - 1, they're identical at the top, the purple and the gray?
There's two pneumographic tubes on the person. So it's monitoring. You need to do that to check to make sure they're not trying to control breathing.
Yeah, but
Just
you
thing to
said
do.
you gave one a -1 and one a +1. One of the purple ones.
Oh, no, I'm just saying, this is a spot, this is an area. +-1 respirations. +-1 electrodermal,
Oh, okay.
+-1 cardiac.
Oh, okay,
So you're just looking for consistency between the upper and
Okay.
lower.
okay, thanks.
But that potentially could be argued the greatest reaction. It's the longest in time. Each one of these bars is 5 seconds. That's the longest amount of time where there's suppression. Okay? So that's pretty easy to see. They're not always that nice. Sometimes you have to look a lot closer. We can also do what's called relative line length. There's a way to actually measure, the programs can actually measure the line length. In other words, from here to here, how long is that line? If that was a piece of string and you stretched it out, and you compare this piece of string and stretched it out, what is the longest length? The shortest length would be the greatest reaction because it's more suppression. Any questions?
So we're looking for consistency, specific reactions, and significant reactions. And when we see that, each time we ask that same question, we know that there's something going wrong. Why don't we just leave it, I think we'll leave it right up here, we'll be good. As long as we're sticking it down here. So that's what we're really looking for in the charts, because we're asking the same questions multiple times. We'll go through the set of questions at a minimum 3 times, sometimes 4. That is a complete exam. And sometimes we're doing more than one exam. With the person, depending on what we see in that first exam. So, just like Bob is pointing out here, there's consistency, they're hitting on it every time, it's significant, you can see it from the back of the room, and it's specific to, especially to the cardio and to the pneumo and to the GSR, there's specific reactions that you see. That's the kind
I
of
didn't
thing.
describe this bottom line. This bottom line is their sensor pad. One of the things that we have to watch for is somebody that goes on the internet, and if you type the word polygraph in the internet, which we often do just to make sure if there's any changes or not, the first 5-6 sites that come up are related to anti-polygraph. It's 2 guys in particular trying to sell books and what have you. So the internet will tell you how to try to create false reactions. As an examiner that's been doing this for years and having my own instrument, even practicing, you can't make it look natural. So these people can't do it, but they try it. And the sensor pad, the things that they try, the sensor pad would show that they're trying something, which would negate things above it. And then if there's a sniff pattern of that, then we have to address it. But
So what you're actually seeing here is the person's actual breathing. It matches up with the respiration, but this is actually a pad that they're sitting on. But it's sensitive to the point where it's picking up the small amount of movement that your body makes when you actually take a breath. So if you tap your toe or curl your feet, this is going to go up through it.
it's also sensitive enough that you could actually see the person's pulse sometimes in there.
Depending on, right, if they're especially with kids, if they're thin or they're athletic, you're going to be able to see that.
So when that other situation where you had deception, did you go back and re-polygraph that person?
That's a very good one. This?
No, yes, that.
Okay, so our policy when we do this in this post-convicted thing is because I said earlier, we don't know for sure if this is the only thing that happened, and so we're here to make sure that we're trying to prevent additional victims, right? We can agree that's all this is about. So we do a second test, but right away, that test is done as a specific issue test to make sure there's not additional victims that we don't know
Right
about.
that day.
Right after this.
So
So
that's-
it's not a confirmatory test on this. It's a test, okay, this guy is keeping secrets. So we need to find out if there's any other victims. Because we're all going to be worried about that. We're responsible to make sure there's not, right? So we're going to find out if there's any additional victims. It's a specific issue test.
But the second test is about now. It's not about the past.
Right.
Is there anything going on now? That's what that's about. And that's my policy. That's our company policy. That's not the APA policy. They don't like my policy because it keeps them from getting another appointment and charging them a fee. So other examiners don't like what we're doing. But we're doing it because of our background, and because this is what we believe in. And we
It's the
wanna
right
make
thing to
sure
do.
It's the right thing to do. We want the public safety. So that's why I established that, and that's how we do it.
So Bob show up and think he's gonna do a 2-hour, 2.5-hour polygraph and do it for 4 hours on one kid. It's not like that happen, and it's happened.
I'm sure it has.
Many times.
Never put a time limit on it. To do a good test, you can't have a time limit. And that's why if you have somebody that thinks they can do 4 tests in a day, they're probably not doing you good work. I'm not giving you quality work.
So I had a question on the break about Asperger's, and I think Bob handled the mental health issues. Although, did he answer your question on that?
Sort of. I think the question is that when a polygraph is ordered and someone has Asperger's, is there any type of consideration for that during the questioning, or would it influence the child's ability to answer, getting a gauge of whether they know exactly right from wrong?
So Asperger's, we understand Asperger's, and like the example I used from you, I know that the kid with Asperger's is going to come in and say, "Huh, that shirt doesn't go with those pants, what are you doing?" And for some examiners, that's going to totally throw them off, and they're going to think, who the hell are you? And it's going to set up this adversarial situation where we understand that. That's the way they're programmed, that's the way their brains work. They say what's on their mind, there's no filter. So as long as you understand that, we can still get through this polygraph exam. But as Bob was saying earlier with the mental health situations, there's always a period of time when we're doing that interview where we're evaluating this person and saying, yeah, today's not going to be this, or we can't do this with this person. I've had kids come in and fake. I've had kids come in and go into an anxiety attack. Maybe we'll do the interview, and maybe that's all we'll ever get done. And maybe that's enough to give therapy some information. Maybe we don't actually need to do the polygraph. Maybe sitting here in front of the instrument with someone new, someone different, and going through the interview, maybe that's enough for this client. That's a determination that we all make together, but we'll decide at that point in time if this is okay to do this.
I think you mentioned that the questions will be altered for the IQ. And what type of indicators do you use to know that they're actually understanding and comprehending? Because the child...
Someone like them, we're going to do the same thing we do with everybody. Because we review all the questions before we do the test. We're talking about them sometimes 3-4 times before they're picked up. And often, when I ask you that question, what does that mean? And you confirm that we're all on the same page. Right? Because sometimes with some of these things, you're splitting hairs, and you need to make sure that when I ask you that question and you say no, what does that mean? That means I didn't do this, I didn't do this, I didn't do that. Oh, they confirmed for me they understand the question. So we're doing that with everybody. It doesn't matter. Now, my wife has taught kids with autism and Asperger's for 15 years with Bucks County Intermediate. So just like how you can do your job with somebody that has Asperger's versus someone that doesn't, so can we. It's all about just being patient and figuring them out and getting them to feel comfortable with you.
So if a judge in the court is asking, if we're not able to use you guys, if the treatment facility is used somewhere else, how confident should we be that that's,
I would,
I don't think we can answer that. It depends on, I mean, I think this is a question you need to have with that examiner and get them to explain it to you so that you can feel comfortable going forward.
I would strive for everyone in here to try to do, I'm not saying what we're doing is the best way, but we're trying to follow best practice. And there's therapists in here and probation officers in here that know. I love someone taking the time to sit down with me for 10 or 15 minutes before the test and make sure we're on the same page. And I would encourage you to do that. Get to know who your examiners are and talk about that. Be prepared before the test. If you're not sure you're going to get a fair test, don't do it. Because I'll tell you, Eric and I have worked very hard to have the reputations that we're not going to do an unethical test. I would say we need to reschedule it or not do it, rather than have someone say I did a bad test. So, you know, I don't want to put more work on you, but you're responsible for your clients, and so it behooves you to make sure that you're getting quality work, or that, you know, that person that day is on their A game.
And I love taking things off the list. Let me just say, here at Matham House, we've had very, very good response and communication with the staff here. This is a really good working relationship that we have going on here. We have that other places too, but I just want to say that here is one of those special places where everybody is coming to us.
Well, Bob literally meets with therapists before the tests. There was a recent really a meeting with a kid, denied, and he actually got a copy, got a copy of the police report, the victim statement that he filed on over. Two nights longer. It was consensual, rough sex, it was consensual. So we're reprogramming for that kid.
We had 3 meetings before that test
Yeah,
to
long.
make sure we were on the same page.
Hours of meetings.
I mean, this is his kid's life. You got to make sure it's done right.
We had the case of before you were here. We had the case at the facility where we ended up getting that kid polygraphed.
Yeah.
He was polygraphed once and failed because it was a bad test, and then we had 2 more tests that he didn't pass because it was not, you know, it was a big publicity kind of case, but it was not the way that it was stated. It was not what was alleged. It didn't happen the same way that it was alleged. There was problems. Kid needed help, but it wasn't what was alleged.
Yeah, and that was pre-placement. That was very unusual situation.
Yeah, because it was actually going into the detention center to do the routine. What other questions?
And in addition to questions, are there any problems that you are seeing that you would want to take this time to brainstorm on how to maybe make it better? Are there things, even the people we're working with now, I mean, sometimes we don't have this type of setting. Is there things that we need to talk about to make sure we keep going in a good direction?
How frequently are you doing polygraphs?
Every day.
No, I mean, let's say a particular client, how frequently, or a resident here, how frequently will you do a polygraph on that resident?
Some programs have us doing a test once a year, some do it every 6 months, some do it every 3 months, some do it if something comes up. So it's kind of hard for me to say a set. I guess
There's
it's
no
on.
standard.
I believe they have to be done at least once a year.
Well, the
depending-
standard for outpatient is once a year,
Yeah.
but inpatient is a whole different ballgame, and it's really a call that you guys make, being probation and therapy, that you guys want to make. It's not a call that we make. So that's something that you guys decide to do. But outpatient wise, the standard pretty much is once a year.
Can we ever be polygraphed too much?
Well, so let me say that about different types of tests. If a person has a denial test from us, or any solid polygraph examiner, and they fail, we don't do the best out of 3. Unless there's new information that comes out that we didn't know before, that test is. As far as polygraphing someone too often, we don't want to the most we can do is 2 tests in a day on the same person. After that, they become inconclusive, they go downhill, people lose their steam, they're tired. If we're doing different topics, we can continue on, once a week, once a month. That's not an issue. If there's things going on that you need to know, 1 week to the next, or 2 months down the road, there's no reason we can't do it. There comes a point in time, though, when we need to switch.
That's what's one of the things that's nice about a group. Because if I've polygraphed somebody 3 or 4 times, or Eric's done somebody 4 or 5 times, we can switch it up. And so that subtle change with the person makes things fresh.
I asked because our judge was concerned, like, this kid's been poly 4 times, like, is he getting used to it? Is that why he's passing? So it's good to know that so we can let them know.
Yep.
Wasn't there something that you were telling us where if something comes up inconclusive or fail, you can repolygraph that kid very quickly as long as the therapist has addressed the issue with him and with the
Yeah.
treatment. But if
Yeah.
it hasn't been treatment, you do not repoly until after there's some intervention.
Right, we would want there to be group time in between for them to address what they failed, be able to come out with it so that, the possibility of them passing the next test, instead of just polygraphing them, unpolygraphing them, unpolygraphing them, and the same thing when they fail.
Is there any possible way that you could pass a polygraph?
If you tell the truth, yes.
But they did it, like this kid clearly did it, but maybe he doesn't remember doing it, and that's why he's passing.
So,
Like, yeah, they blackout drunk,
right,
doesn't remember.
in this work, which is to us, it's called PSOT, post-convicted sex offender testing. So in PSOT work, there is a test that another examiner and I kind of put our heads together and came up with a long time ago. And we call it our memory refresher test, where we don't ask if you did it, we ask if you remember if you did it. So that kind of a test, if we get an inconclusive, which is what I would expect from someone that truly doesn't remember. They're concerned that they did it, but they don't know if they did it. That's where an inconclusive would tell me they didn't remember. So we can do that test because people use that all the time, especially adults. They use that all the time to try and skirt the whole issue. I don't remember if I did it or not. Oh, well, let's see if you remember. They don't expect us to ask that. We ask that and they fail. Well, yeah, they remember. They did it and they remember.
Did you do that test on the kid from Montana?
I think that maybe we did.
Because that was a blackout drunk.
Right.
So if you're going to follow the principle of what makes polygraph work, then you have to say theoretically, when you understand what a sight picture is, if a person legitimately doesn't remember, just for the same reason you wouldn't test somebody with multiple personality disorder, you don't know if you're talking to Tom Jones or Rick Smith. Tom Jones committed the crime, Rick Smith didn't. So theoretically, yeah, if they legitimately don't have anything to respond to up there, they could pass, even though it's on CCTV that they did it.
And even with the multiple personality, I tested people with multiple personalities. There's usually one personality that knows what everyone else did. And you have to make sure you're talking to that person by the polygraph. So you have to continue to use that name to make sure that you're hitting the nail on the head, because that's the only personality that knows what all these other personalities has done.
So are there is there any kind of person or character trait or personality that would be an exclusion to taking a polygraph?
So our bottom line is we don't want to test anyone under age 14. We don't want to test anyone that obviously the mental health situation is such that we can't communicate. They're probably not going to be under caseload anyway, I'm going to guess.
So you're talking about someone like developmentally disabled?
Right. They're probably going to be in a different kind of court. They're probably going to be in a different kind of facility, and they're probably not going to be on your caseload. That kind of person is enough. Anyone else, there's no reason why we shouldn't at least meet with them and help to make a determination whether we can do this.
Other reasons that we might not do a test is during the pre-test interview, we find out that a woman's pregnant. One of our ethical violations is not test somebody, not to put someone under that psychological stress and maybe potentially hurt the development of the child. Somebody that had a recent trauma or recent illness, that you might not be getting a true picture of them, you would have to reschedule that to when you return to the normal health.
What about somebody that's on a critical process of trauma like a benzodiazepine or immune stabilizer, and that interfere with the outcome of the
It could potentially suppress everything, so you have to see if you can still see reactions and there's comparative reactions, you can still do it. It might make it harder to read the charts. Certain medications make it harder for the heart to react. Somebody's on certain blood pressure medications that you might not see as much, but it doesn't mean they're not testable. It just makes it a little harder on us. But if someone doesn't react at all, then again, I'm going to not do the test.
Yeah, that was going to be my follow-up, but this myth that kids, they talk about everything. Take this drug, take that drug, you'll pass the test.
The drug can't decide whether it's going to react to this one or this one. It's going to, yes, there are things that will suppress the body overall, but it doesn't change. You can't pick and choose which one it's going to react to.
Especially in the outpatient world, I mean, we have clients that come in and they use the restroom and pop a Zanny or a perk, and then come in to take our test. Well, their mood's going to be altered. We're going to pick up on that in the interview. And don't forget, this is all videotaped. So our whole appointment from start to end is on video. And there's nothing to say that you can't request a copy of that video and you can say, who is this? I don't recognize this person. What is this personality coming out? Because this is not normal. That you would be able to say there's something different about today for this guy that maybe allowed him to take the test. And if that's true, we can come back and say, that test is invalid.
So, would that be your experience that if they were going to take some kind of medication, they wouldn't come in under the influence? They would excuse themselves, like you said, use the bathroom, and then, so at some point during the interview process, you would be like,
Right, right. And so we're still going to see all this, but it's going to be diminished. So the character question, there may not be anything at all, but we're still going to see something. If we don't see anything at all, it's a clue to us there's something else going on. There's something else with this person that's up that we don't know. And not knowing them, because we usually only see these people at the most once a year, we're going to come back to you and say, is this the way this person normally acts, or try and get a read on that, and that's where that video can very easily come into play. If you guys can look at it and say, this personality is totally off.
Does sleep deprivation change the result?
You do want to have a person have the best case scenario is a person's their most normal self. If they're insulin dependent diabetic, they take their insulin every day at 8 o'clock. I want to test them on a day they took their insulin at 8 o'clock and they had it pretty much in the sleep. So again, that could be something. I've had to continue tests, especially in the criminal investigative end. The district attorney sets up a test.
Yes, and then